Keir Starmer urgently needs to do something about the NHS. Now, he has pledged on various occasions that he's going to do various things, but as we all know, Keir Starmer's pledges are worth less than a Network Rail timetable at the moment. So let's just talk about the scale of the problem. Currently, 7.6 million people are waiting for routine treatment on the NHS. Inevitably, that means that people are dying as a result of not being able to access the treatment that they need. And we know about ambulances not being able to get to people in time. We know about accident and emergency rooms being overflowing, people not being able to get treatment. We know people are dying every day because the NHS is past capacity and is grotesquely understaffed. That state of affairs doesn't even make economic sense. 1 in 10 people in Britain is currently waiting for routine treatment. And while they're waiting, they're less likely to be able to work. They're more likely to need pain relief. They're more likely to need mental health support. They're more likely to end up needing more treatment when they do finally get treated because conditions tend to get worse. And they're less able to contribute to our society generally in terms of caring work, in terms of supporting others, in terms of volunteering work, all that kinds of stuff. That's actually a really important part of how we function as a society. And it also shows, I think, a disrespect just for people in general. If we're genuinely willing to sit back and assume that we all will spend a tenth of our lives waiting for routine health treatment. That is not how you spend your life. That's not what your life is about, you know? You should get the treatment that you need immediately, as soon as possible, right? What Keir Starmer has done about the situation, first of all, is to put Wes Streeting in charge, and Wes Streeting only won his seat by just over 500 votes, and I'm kind of gutted that Leanne Mohammed didn't manage to take it off him, because I think it would have sent a really clear message about how important our health service is and how much we don't want private healthcare interests in there. However, he managed to scrape it thanks to our corrupt voting system. And we're talking about a man who, in the last year, has taken £175,000 in donations from individuals with very close links to private healthcare companies. So it's not a question of what's his position on private healthcare interests. So he's absolutely sat in their pockets. He wrote an article in The Sun. You know, The Sun, who I thought Keir Starmer said he wasn't going to talk to. He wrote an article in The Sun saying, Wes Streeting is saying that he will fight middle-class lefties who oppose increased private involvement in the NHS. Isn't the Labour Party supposed to be at least vaguely left-wing? And, you know, if wanting nationalised healthcare makes me a middle-class lefty, all right, fine. Is that a bad thing? That strikes me as absolutely terrifying. What Wes Streeting has done as his first step is written another article in The Sun. And in this piece, he says he's going to launch an investigation into the performance of the health service. Which is weird, isn't it? Because it's only a couple of months ago that he seemed to know what the problem was. It was all the middle-class lefties who'd got the wrong idea, and he knew what the solution was, which was to get increased private healthcare involvement. So why exactly does he need to do an investigation? It makes absolutely no sense. Also, there's a lot of research already out there on the subject. Organisations like nurses' unions, doctors' unions, patients' groups, people like Every Doctor, all those kind of organisations have already been through what's happening with the NHS and have put together robust proposals. Wes Streeting doesn't need to launch a consultation on this. All this is an excuse for him to waste more time and more money gathering up the opinions of his billionaire mates who know exactly what they're going to recommend. They're going to recommend that he take a ton of money and hand it to them, just like they did to him as he was in the run-up to the election. This new, I'm going to say it, quango, that's the word, isn't it? This new quango is led by Lord Darzi. And in case that name sounds familiar, Lord Darzi was the health minister under Gordon Brown, and he advocated, you'll be amazed when I tell you, increased private involvement in the health service, came up with this idea of starting what were called polyclinics, which didn't work, and it was like a totally failed scheme, but they were basically seen as a kind of gateway to increased privatisation of the health service. So he's hired this guy who loves private healthcare to review what we can do with the health service while being funded by private healthcare. We know what you're going to say at the end of this, Wes, so don't freaking bother, because you're wrong. Already, I'm telling you for free, you're wrong. I think so, the doctors think so, the nurses think so, the patients think so. Everybody around the UK thinks that the one thing we care about more than anything is the NHS. It's absolutely the pride of the whole damn nation. And all that needs to be done with it is it needs to be funded properly, supported, and taken back out of the clutches of private healthcare firms, because all the funding we've got for the NHS should go to the NHS, not into corporate profits, where it can be leaked out again and stuffed into ministers' pockets. This is the moment for Keir Starmer to make a decision. And there's no point in pretending that this is part of a deliberation process. This is part of a justifying the wrong decision process. And Keir Starmer needs to stop it in its tracks and instead make the right decision for the benefit of all 7.6 million people currently unable to get the treatment that they need. See you next week. Increasingly, the mainstream media is terrible at informing the public of what is really going on. I'm only able to make these videos because people are generous enough to sponsor me making them, and if you're able to be a part of that, I would hugely appreciate it. It can cost as little as $1 a month and you'll get loads of fun bonus content and lots of extras from me, and my undying gratitude. I also massively appreciate it if you're able to like, share these videos and let people out there know what's going on.